My name is Claire Campbell. I work in patient safety here at Ochsner. My clinical background, I did pediatric oncology and some med-surg. So I'm 42 now. I started doing monthly breast self-exams when I turned 40. About August, just for my monthly exam in August of 2025, I felt something that just felt off. Wasn't quite sure if it was a lump or what it was. It just felt off. Being a single parent and knowing that I've got to keep myself healthy to be here for my boys, it was just not a question of going in or not. So I was diagnosed with breast cancer that also had spread to some of the lymph nodes under my arm. My mammogram was 5 months before my diagnosis, and it was clear.
So I was the first person to call Claire and give her the results of her biopsy, which was performed after her mammogram. And my first impression was any young mother's worst fear and impression when they were diagnosed with breast cancer. Claire was very anxious. She was very scared.
So I'd been with my parents, and they said in the moment when I saw the results that it was an out-of-body experience for me, but apparently I screamed and dropped to the floor, and the first thing I said was, "My boys, my boys."
She was a nurse prior to this, so she did have a baseline of education, which is helpful when describing patients what they're going to go through and what journey they're going to go on.
And so I knew from the outset, before I even met her, that she was a well-respected person who had lots of folks on her side. She was obviously a favorite to the group of people she had worked with and was currently working with.
It's a very scary, numbing moment, but I know for me, at least, once I had a plan, I was like, okay, let's do this.
But she was ready to face this battle head on, and she was ready to work with her care team to be able to help her through this journey.
She got chemotherapy that is really difficult, and I was so impressed at how she tolerated it. She had a positive attitude the whole time.
The chemo that I received, at least the first 2 chemos that I received, was chemotherapy that I once administered to pediatric oncology patients that I took care of. And for me, that was really a full circle moment of, I was on the caregiver side of it. Now I've been on the patient side of it. One thing I have to say that I've realized is how tough kids are, because the chemo was very tough. And when I think about what, I gave to them and what I experienced, children are incredibly resilient.
Claire had a really rare, unique complication to her chemotherapy, resulting in a hospitalization.
I had an echocardiogram just to check in on how my heart was doing, and incidentally, a mass was found in my heart, in my right atrium. And so being admitted, knowing that I had the strong possibility of needing heart surgery in the middle of this cancer journey, was the hardest moment in this whole journey. And I said, before I go, can I just give my kids a hug when they get off the bus? I just want to hug them before I go. And she said, yes, it can wait. Hug them and then head this way.
We acted on that complication on her imaging very quickly,
And it ended up being a blood clot that presented odd.
got multiple teams involved to look at her imaging and put her on the right medication to help with that complication. It's very important to coordinate care among our team and among specialists to really help make sure that we're treating the whole patient and not just their cancer.
And Claire's decision to have a mastectomy gave us nice assurance that we would be confident in clearing all of the disease from her breast. She was very involved in all decision making, and she was eager to do whatever it was going to take to get rid of this disease.
In the cancer world, I'm told they don't really say, well, you're cured of your cancer. The terminology they use is that there's no evidence of disease. And that moment for me, I think, was when my double mastectomy. I had had all my chemo at that point and had my double mastectomy, and I had my post-op visit with Dr. Rivere, and I remembered her assuring me, we got it all. We got all the cancer. And that moment was really, really exciting. It was like really great.
Every day I meet with patients who have the unfortunate diagnosis of breast cancer, and every day I go to the operating room and I try to take out every last cell of that breast cancer so that I can see them back in the office and say, you have no evidence of disease.
I think I hugged Dr. Rivere. I don't remember asking for permission. I think I just got up and hugged her, and she was okay with that.
Claire's story means a lot to me because I feel like I got to see Claire from start to finish. I got to make that initial phone call and see Claire all the way through her journey, still seeing Claire on the journey where she is now.
I think anytime one of our colleagues has a difficult time, it's been obvious to me over the years that nurses tend to rally around that colleague. Claire had a team of nurses rallying around her, and so I think this is a perfect example of how nurses can bond together over a difficult time and come out on ahead.
In my mind, I've gotten through the hard part, and so now I just have to focus on staying present in the moments, and I don't want to live in fear of it coming back. I refuse to allow that to dictate my life and to let that define me. So from here, it's just making lots of memories with my boys and getting to watch them grow.